Hello all, my name is Ashley Blumhoff and I will be presenting for you today 3 topics for my psychology presentation. The first of which is REM sleep, and I chose this as a topic for my presentation because I never knew that our bodies could go through a series of 5 distinct sleep changes every 90 minutes when we are sleeping. REM sleep is also known as rapid eye movement sleep, and it's a phase when vivid dreams commonly occur. It's also known as paradoxical sleep because when we are sleeping, our muscles are relaxed, but our body systems are still active. Researchers who study sleeping patterns see relatively slow alpha waves in the first stages of sleeping, and it's categorized by being awake yet in a relaxed state. The second stage of sleeping is characterized by the periodic appearance of sleep spindles, or bursts of rapid rhythmic brainwave activity. Although someone can still be easily awakened during the sleep stage, it is obvious that they are still sleeping. For the next few minutes, a participant in such a research program will transition from stage 3 to the deep sleep of stage 4. First in stage 3 and increasingly in stage 4, the brain emits large, slow delta waves, which the participant is hard to awaken. This process occurs for about 30 more minutes, during which the participant is hard to awaken. Rather than staying in constant deep slumber, the person will ascend from the deep sleep dive. Recurring from stage 3 and 2, where most of the night is spent, the most intriguing phase of all is, of course, REM sleep. For approximately 10 minutes, unlike stage 1 sleep, the heart rate rises, breathing becomes irregular, heart rate becomes more rapid and irregular, and it lasts for every half minute or so until the participant's eyes dart around in momentary bursts of activity behind closed lids. Although the brain's motor cortex is active during REM sleep, the brainstem blocks its messages, leaving the partner's muscles relaxed. So relaxed that, except for an occasional finger or toe twitch, the patient is essentially paralyzed. For the next topic of my presentation, I chose coping with stress. I chose coping with stress and the factors that affect our ability to cope with stress successfully because I frequently get stressed with schoolwork. Figuring out how to deal with my stress in a healthy way will help to promote my health by preventing illness and enhance my wellness. Stressors are unavoidable, as we all know. Persistent stress leads to heart disease and lowered immunity and other bodily ailments. We must learn to cope with our stress by finding emotional, cognitive, or behavioral ways to alleviate it. Some stressors we will face directly with problem-focused coping, or attempting to alleviate stress directly by changing the stressor or the way we interact with that stressor. Other stressors we may find easier to alleviate through emotion-focused coping, or attempting to alleviate stress by avoiding or ignoring a stressor and attending to emotional needs related to one's stress reaction. We tend to use problem-focused strategies when we feel that we can control the situation at hand and change the circumstances. I chose hypnosis. I chose hypnosis as a topic for my presentation because I was always interested in how hypnosis works, if it is factual or fraudulent, and if anybody could experience such a bizarre interaction. Hypnosis is defined as a social interaction which one person, the hypnotist, suggests to another, the subject, that certain perceptions, feelings, thoughts, or behaviors will spontaneously occur. Those who study hypnosis agree that its power resides not in the hypnotist, but in the subject's openness to suggestion. Hypnotists have no magical or mind control power. They merely engage people's ability to focus on certain images or behaviors. Hypnosis is thought to enhance recall of forgotten events, force people to act against their will, or act as therapy and alleviate pain. Hypnosis does not help with the recall of forgotten events and does not force people to act against their will. However, according to research, it does prove to be therapeutic and has helped to alleviate headaches, asthma, and stress-related skin disorders. Obesity, drug and alcohol, and smoking addictions also respond well to hypnosis. Hypnosis has also helped to relieve pain. Patients have required less medication, recovered sooner, and left the hospital earlier than unhypnotized patients, and it helps with the inhibition of pain-related brain activity. One theory of hypnotic pain relief finds the answer in dissociation, a split between different levels of consciousness. Hypnosis, it suggests, dissociates the sensation of the pain stimulus, of which the subject is still aware, from the emotional suffering that defines our experience as pain.